Hello, everyone. My name is Dominique Smith, and I work for the CoLab. And my role primarily is doing community outreach. I use she, her pronouns, and I'm so excited and humbled to share this space with Miss Makinie. Would you like to introduce yourself?
Yes. Hi, everybody. My name is Makinie Fortino. I'm a licensed marriage and family therapist, and I will be collaborating with UW CoLab through DMHS, Deconstructing the Mental Health System, which is the organization that I founded.
Thank you so much, Makinie. Again, we appreciate you taking the time to meet with us today and share more about what you do. So, can you tell us the name of your organization and what it is exactly you do?
Yeah. Do you mind if I share my screen while I talk about it?
Oh, please.
Okay. So the organization I founded is called DMHS, Deconstructing the Mental Health System. And our main mission and goal is to build equity in mental health for people who identify as Black, Indigenous, or people of color. And how we do that is making providers of color or providers who identify as Black, Indigenous, or people of color more accessible. We do that in a few different ways, and we also build equity in a few different ways. Part of that is highlighting the works of organizations led by people of color, so that's culturally relevant resources, organizations we like. Part of that is listing and prioritizing resources, general resources for people of color. And another piece of that is highlighting low-cost continuing education courses for professionals who need that to maintain their license. But the main offering that we have is a directory, which I will show you. So our directory accomplishes a couple of things. The first is it helps save money for providers and advertise their services for free indefinitely.
Oh, wow. Okay, that's good.
Means that it's free for the public to access. And we also wanted to make sure that for people who identify as queer, trans, people of color, or LGBTQIA+, that they could find safe resources who are culturally relevant to them more easily. And the second thing that we have here is cultural health and wellness providers, because there's more than one way to heal. It's not just through traditional mental health services. It could be through Reiki, through yoga, through meditation. So we have that section as well. And right now we're almost at 180 listings.
Wow, that is amazing.
Oh, thank you. That's different from 180 providers. It's listings because we also have group practices. So some of these listings have up to 10 providers.
Oh, wow. Okay. Okay. That's great for the people to know. Wow. And so anyone can go on on your website and go under BIPOC provider and pick whichever one that they need. Okay.
Yeah.
Thank you so much for sharing.
Yeah, of course.
All right. So this next question is just super exciting for me because I'm so happy for everyone, especially the community, to hear about all the work that you do and to be able to follow your work. So if you could tell me the solution of your organization, the solution that it proposes.
So one, building equity into mental health services. And I kind of mentioned it a little bit earlier with making it more affordable to be a therapist, to list yourself for free indefinitely. But I think the other thing is consolidation of resources, because there are a lot of directories out there. And a lot of people can't find them. And I think part of that is the directories are sort of standalones, where ours, we say, you might not be able to find the therapist or provider that you're looking for here, but we have 50 different organizations, like explicitly logo and everything listed on a page called organizations we like. And some of those are directories as well. And then in our get help and resources section, we have another like 150 options.
Wow. Oh
So
my
we
goodness.
like one of our strengths is consolidating information and directories. So if they can't find it on ours, they can definitely find it through our organizations we like or a get help section.
Okay. And so just as another resource, and some of these organizations, are they all located in Washington State? Are they telehealth services?
That's a great question. So it's this is a national directory that we have, and the organizations we like page also is national, but I would say about half. So maybe like 80, like 60 to 80 of the listings that we do have are Washington State exclusively.
Great. Okay.
And yeah.
Okay. And so my next question is who are the people that you primarily serve? And what is the location of your organization? I know that since the pandemic has started, a lot of providers provide telehealth services. So are you seeing patients in person? Do you offer telehealth services?
So as through Makinie Therapy LLC, I do telehealth. Through DMHS, since it's the directory, the providers decide what kind of services they want to provide and what method they use for that. A lot of our therapists offer hybrid, so either online or in person.
Okay.
And the primary constituent is melanated people or people who identify as Black, Indigenous, or people of color.
Okay, that's great to know. I know having that telehealth service is extremely convenient, and with the pandemic still going on, to be able to do that, virtually is definitely helpful. Um, why are you involved in this work?
To be honest with you, I got tired.
Mm-hmm.
Um, People reaching out to me for services. One, I found that as an individual, I felt like I wasn't doing enough. That I could help one person at a time, or in the organizations that I was working for, I could intervene one moment at a time, one case at a time. But people kept reaching out for services and saying, it's taken 6 months to find you, or I've been looking for a therapist for 12 months. And I was like, I know the resources are out there, and I know that there are therapists who are available, but the information for whatever reason isn't accessible. And so that's really what we're seeking to do, is to shorten the amount of time that it takes for people to find providers who are culturally relevant, who aren't going to harm them intentionally or unintentionally.
And that's so important. And I know navigating, and trying to find a provider and doing a Google search, those things they take a lot of time. You're not always able to find a direct provider. And so really being able to come on your website is like a one-stop shop to be able to, pick which community you identify with, and to have, the providers that you list is definitely crucial. Would you be able to share one, and it can be small, it can be big, it's up to you. One of the accomplishments that you're really proud of since you've had your organization.
The growth of the directory. In
Okay.
January, we were at 40. And part of that was that I, up until December, I was employed, and I left my job to go full-time private practice. And I was like, awesome, I have more time to really put effort into building this directory up. So we were at 40 in January, and now we're almost at 180. And
Wow.
I did not do that alone. That was a team effort with a number of other organizations, and I'm really, really proud that we grew that much.
Wow, that is definitely amazing. And for the people who don't know, would you be able to tell us when you started your nonprofit?
Yeah. I believe it was January of 2021.
Okay. Wow, so right in the heart of the of the pandemic. And you
Yeah.
said you left your position to be able to start um your nonprofit.
Yes.
Wow.
Yes.
Okay.
Well, it had already started, but I think only putting in like a couple of hours a week. Not enough time not enough time to get the information out there, not enough time to collaborate with other organizations or build the directory. And so a big part of why I ended up leaving was so I can put more time and energy into it.
Absolutely. And just to see the growth is tremendous. I'm so happy to hear about those providers. And I know being on this care project, I have definitely shared your work with as many people as I can. We definitely want to get the word out. We're so excited to be able to have a partnership with you and just to gain your expertise as well as lived experience. You know, you've lived this experience, you've gone through this journey. And so that brings me to what makes you most excited to be a part of the CARE project?
I love the way our missions and visions align. You want to build equity in mental health, and so does DMHS. You
Yes.
help children and families find services that they need, but also have culturally relevant services, which means that the care team recognizes that there is harm being done to families, especially families in poverty and families of color, in part because it's harder to find services or they're uninsured, can't afford it, or when they do receive services, it's by people who don't understand the culture, therefore can do more harm. And I really like the fact that the care team wants to find a solution where services are available, affordable, and culturally relevant. It aligns perfectly with what we're trying to do.
I'm so happy to hear that. I thank you so much for your time, Makinie, sharing with us your work and what you do. And that part about representation is really what we're working hard to do and to make sure that, you know, our kids who are being treated, that they see people who look like them, and that they're comfortable. And so I'm just so happy to share this time with you and to hear more about what you do. And as a project amplifier for the CARE project, if anyone would like to continue to see Makinie's work, what she's doing in her website, we will list it in the description of this video, as well as if you know anyone who's interested in the CARE program or the CARE project, or to share out what we're doing for the CARE project, our website links will be shared in the description of this video. Makinie, thank you so much for your time.
Thank you so much, Dominique. It has been an honor.
Thank you. And thank you all for watching.